All right. Hi, guys. My name is Sarah Saunders. I am a senior here at Kansas State, and the illness I chose is cystic fibrosis. So, what exactly is it? Cystic fibrosis is a progressive and genetic disease with multiple lung infections, and it also limits breathing. But the thing is, with the limiting of the breathing, that gets worse over time. This whole cystic fibrosis increasingly gets worse as you get older. And the lung infections are basically pneumonia and bronchitis. But the thing is about cystic fibrosis is anyone who actually has this illness usually has a short lifespan. So I think the average lifespan would be about 37 to like 40 years of age. But then again, what exactly is it in a more in-depth version? So this is a cystic fibrosis transmembrane conductance regulator, which causes a gene to become dysfunctional. And then that gene creates chloride, which is basically a salt substance. And then that chloride helps remove mucus in the lungs, which helps open up the airways. But then when there is no chloride, that increases the chance of infections and inflammation. So the chloride helps remove the mucus, which opens up the airways. If there's no chloride, bad things are going to happen. So, and then what are some symptoms of cystic fibrosis? So the most frequent is there's frequent coughing, and usually there's phlegm, mucus, just yuckiness. A lot of lung infections, which bronchitis, pneumonia, and then wheezing, pneumonia again. And then I thought this one was super interesting. Actually, an actual more commonly than you would think it would be, symptom is salty tasting of the skin. But it's not just like, ooh, that's salt. It's like an overpowering kind of saltiness from what I've gathered. The overall diagnosis, so there is a genetic test. Let me take that back. Genetic testing. It's made up of multiple tests. So that would be a newborn screening, a sweat test, genetic carrier test. And then after all of those tests are completed, then the parents and the child will then go to a clinical evaluation at a cystic fibrosis care center. And those care centers specialize in cystic fibrosis. That's where the child would get their diagnosis. But with a genetic carrier test, those parents are getting tested to see if they have that gene, the cystic fibrosis gene. But the thing is both parents must have a copy of that CF gene. So let's say that the mom has a copy of the gene, but the father does not have a copy of that gene. That child would not have cystic fibrosis. Whereas if the mom has a copy, the dad has the copy, then that child would have a copy of the CF gene. Most children are diagnosed by age 2. I think that's about 75% of the cases out there. But there also are adults who are diagnosed, which is almost very rare. Because like I said, most children are diagnosed by age 2. And then 300,000 people are diagnosed worldwide, and 1,000 new cases are diagnosed each year. What is the treatment? What does it look like? Is there even any out there? So sadly, cystic fibrosis is not curable, but there are therapies and treatments out there. So each therapy is tailored to each individual because there are drastic cases of cystic fibrosis. Some are more severe, some are less severe based on the symptoms, their life expectancy. So a couple of those therapies are an airway clearance. This loosens and gets rid of the mucus. Another therapy is inhaled medications. This is just a way of opening up the airways. It thins the mucus and it fights lung infections. For example, I think this is the main usage of medication because normally they might not take a pill, or a liquid syrup. They're gonna want the medication to go right into their passageways, which is why it's going to be up the nasal canal, down, and in the that airways. Lastly, there is also a lung transplant that is for a more serious case of CF, but obviously not every single child with CF will need a lung transplant. It's only going to be those ones that are very, very severe. Resources to tell the child about the illness. So I personally think it depends on the age. For preschoolers, middle childhood, aged range children, I think that picture books would be an awesome idea, just because those kiddos are at a different developmental age than, let's say, a teenager would be, or even a young adult would be. And so those kiddos are going to be more focused on the awesome pictures. They're going to be more zoned in on the book itself than maybe just having a doctor, a nurse, a child eye specialist just saying, hey, Brian, this is exactly what's happening. This is what you're going to go through. And I think also the words that they choose in those books are going to be more adequate for children that age. They're going to use better words to be able to have those children understand and acknowledge exactly what is going to happen, what is happening, and what their illness is. But then again, I think that another resource which would be super beneficial are online resources, whether that is Google, any kind of like doctor websites, even YouTube would be super beneficial. I think that this could help anyone of all ages. For example, let's say that there is a parent who has a child with cystic fibrosis. They're trying to figure out exactly how they're going to explain it to their child that they have cystic fibrosis, how they can better understand what cystic fibrosis is. And so let's say the parent goes online, they're going to YouTube, they Google, they search, what exactly is cystic fibrosis? Are there treatments? What to expect? That video is going to relay information to them. So they're going to benefit from that, but then also their child would benefit from that, and their family members also, just because they're going to be able to explain what exactly they just learned and what they just gained from that video, from that website, etc., to the developmental age of their child, of their grandma, of their mom, so on and so forth. So it's not only beneficial for the parent, but it's also beneficial from the family members, friends, and their child. So the developmental stage of middle childhood, that is the age group I chose. So middle childhood is initiative versus guilt, and then also pre-operational. The physical development of a middle childhood, which is aged range from 6 to 11 years old, they are identifying their sex. They are half the size of a typical adult. And then their cognitive development is their egocentrism exists but begins to decrease with age. And then their magical thinking is used in reasoning. And lastly, their emotional development is their beginning of empathy. So they are having an understanding of how others feel and be able to feel with them. And then a degree of independence, being able to not solely rely on their parents, their family members, their siblings, and their friends. They're getting that independence. So a negative effect for development is the CF actually reduces the ability to eat food. And so a lot of these kiddos aren't getting the necessary requirement of nourishment. So I know a lot of the kids have to have certain not necessarily meal replacements, but different kinds of nourishment. So they're going to have, instead of having like a piece of chicken for dinner, they're going to have like a protein shake that has different vitamins and nourishments that the body will actually need, if that makes sense. But then also this is going to relate back to Shawakman-Diamond syndrome. And the cystic fibrosis also leads to different other causes. And the Shawakman-Diamond syndrome is one of those causes, but then that also can result to cystic fibrosis diabetes, which is kind of scary depending on the severity of that, especially in a young child. But then also a negative effect for the development would be being in and out of the hospital. A lot of the children go 1 to 3 times a month, depending on how severe their case is. But I think that also depends being in and out of the hospital 1 to 3 times a month, that is also going to affect how their development is based on going to school, being able to go to school. But that also relies a lot on how long they're going to be in the hospital for. So a lot of these kiddos are just going for checkups to see where they're at, which is going to result in a checkup of the chest x-ray, how well they're eating, if they need to fix their eating habits. And then also if they do get that bronchitis, pneumonia, those lung infections, that could also put them in the hospital for a longer period of time. But also that is going to relate on how much school they're missing out on, if they're missing out on if they're missing a class, like a math class. Some people have to be in math class, they can't skip a day, and that might put them back on track. Also, for the social aspect, these kiddos who might be stuck in hospitals for a couple days to a week based on if they're really, really sick or not, they might be just surrounded by family and friends and hospital workers, nurses, doctors, child life specialists. So that might put a decrease, a damper, or even a pause on their social development, just because they're being surrounded by the same people every single day. And kids definitely need a mixture of who they're talking with, who they're hanging out with, to increase that development. Next, a prep for an x-ray. Like I said, the kids will be going to the doctor, and when they do get those checkups, they will get an x-ray, and that is a common occurrence for children with CF. And so with that being said, when the middle childhood kiddos, they are ranging from 6 to 11 years old. So that is still in elementary school. That's either kindergarten to 5th or 6th grade. So they have every right to still be nervous, still be scared of hospitals, of doctors, and all of that stigma, the stereotypes that actually come with the hospitals. And so that leads into separation anxiety and making sure that the child is comfortable. So, when children go for an x-ray, they have to leave their parents from their room, their check-in room. Their parents have to stay there, and then either the doctor, the x-ray technician is going to come and grab that child and walk them down to the room. So just making sure that they are comfortable, they know exactly what's going to happen. And I think a way of that is, depending on the age, asking them how they are, using that conversation to kind of steer them away from the scariness, but also maybe giving them a game to play down the hallway, or say maybe like I Spy, and having the kiddo go first, making them try to find an item in the hallway or in the hospital, and me trying to guess it, or the doctor trying to guess it, or even giving them a little Nintendo DS, for example. Being able to play on that DS while going down the hallway, I think it really takes away from the whole reason they're going there, which I think would help with the anxiety aspect. Also, description words, I think, is very necessary. Not exactly telling them word for word what's going to happen, but just making sure that, hey, this is what's going to happen. This is an idea of what's going to happen. If you need anyone, I am here for you. Your mom or your dad's not going to be able to go, but I promise you, you're going to be just as safe and sound. No worries there. And giving them a run through of what could happen, what will happen, not what could, what will happen, but not, like I said, word for word exactly this is what's going to happen, but just telling them that you're going to get a big chest cover thing. It's just going to protect you, and using the correct words in that way, from the rays, the UV rays or whatnot, that is going in from the X-ray. But yeah, so that would be a prep for the X-ray. And then here are a list of my references that I used for this presentation and this project. But yeah, like I said, my name is Sarah Saunders, and this is cystic fibrosis.